And this is, I got hold of some this operative photograph somewhere. And this is a classical, a transparent balloon dilated, distended with water-like solution. Looks like a transparent balloon with coursing overlying small vessels. That is an epididymal cyst, and that is the normal testes.
Thank you, sir. I would request Professor Kapkar to give his comments, and then I will have my own things to say.
Thank you, Dr. Thusoo. I think in a span of 35-40 minutes, he's covered the whole gamut of testicular and extratesticular pathologies. It's always an education to listen to him. He always has something new to tell you. I had never heard of epidermoid cyst of the testes, to be very honest. It's great. Just a word of caution to the residents. In examination, from clinical point of view, you get 3 pathologies. I hope Dr. Thusoo would excuse me to interfere. A hydrocele, a varicocele, and a variant of hernia. I have seen candidates losing their wickets on hydrocele. Dr. Thusoo would recall we had an excellent teacher who unfortunately is no more. I don't mind naming him, Dr. K.C. Mittal. And I remember 1968, January, we were in the OPD. He gave a case of scrotal swelling to one of the postgraduates. And after 15 minutes, he said, okay, let's discuss. And this physical examination, for some reason, was not up to the mark, and he diagnosed as a case of testicular tumor. I know the hell he went through, because it was nothing but a plain, simple, dense vaginal hydrocele. So please do not underrate the scrotal swelling from practical point of view. If you get a case, you are expected to know nearly everything about the pathology, the anatomy, and the management. So please do pay attention to these cases of hydrocele, the varicoceles, the variants of hernia like hydrocele and bisac, etc. Thank you, Dr. Thusoo. It was great. It was great.
Thank you, Dr. Kakar.